Thank you so much, everybody. Really, I'm impressed for your presence. I'm very happy to be with you from Paris directly, and this is a wonderful congress. So in a couple of minutes, I will be with you for a little concept for treatment of the oral area, particularly nasolabial fold, because we consider it as a simple way, but it's not really simple. So as a disclosure, I'm the scientific director of the FieldMed laboratory in Paris, and some of the data in this publication, in this presentation, they are the published or non-published data belonging to this company. I'm a dermatologist. I have a PhD in life science. I have 2 fellowships in wound healing and also aesthetic dermatology. I'm the board member of the imaging group. This is my passion, really my passion to do the skin imaging. I'm a member of the European Society of Dermatological Research and a member of the scientific committee of several congresses like IMCAS, that you know it well. And I have some experience in laser, confocal microscopy, corrective injection, skin biometrology, and research in dermatology. So I'm honored to be the editor of one of the major reference in skin diagnosis. The name is Agash Measuring the Skin, is dedicated to Professor Agash, who died in 2004. And this second edition has 2 volumes with 1,700 pages. And I'm honored to be now on the 3rd edition with 3,000 pages and 3 volumes. And fortunately, I have a good news for you. Professor Li He translated this very big textbook with 161 professors. And it is accessible in China by Springer. So if you want, you can order it by Springer. So it contains all of the non-invasive techniques to evaluate the skin. So in a couple of minutes, I will be with you for these contents, why the nasolabial fold is important, what is the treatment options, what is the safety tips, which filler types we can use for it, and also I will introduce one of the technology in the HA filler, the Trial technology, and the clinical trials on different treatment methods. So, what is the importance of the nasolabial fold? Because nasolabial fold is an area where the cutaneous insertion of the lip elevators fuse onto the ligamentous structure formed by this mass and also deeper facial fascia. And the nasolabial fold is very unique. It's a unique structure as it is one of the earliest signs of the aging and is disdained by most people early on the life, even very young people. And it is also very unusual structure because it is absent in birth, present at death, and diminished with facial nerve damage. And despite all technology and advances, the nasolabial fold remains undefeated. So why is accentuated? Because we have the reduction of skin thickness over the fold, we have excessive ptosis skin lateral to the nasolabial fold, excessive fat deposit lateral to the folds that are fixed in place of the retaining ligaments, and we have the ptosis of the malar and submalar fat compartment. So for the treatment of the nasolabial fold, we should pay attention to these points, that they are very important. The mid-face volume loss, pseudoptosis and ptosis, the inferior nasolabial volume excess, the tethering effect of the ligamentous insertion at the nasolabial crease, and also the skin texture and laxity. So by this way, you need a very good quality products can cover all of these, needs. So For the treatment approach, I invite you to see this very wonderful publication by Estefura. It's a meta-analysis published in 2021 on 51 trials on 4,097 patients on Canada, China, France, Germany, Italy, Norway, South Korea, Spain, Sweden, Switzerland, UK, United Arab Emirates, and also USA. So it covers a little all of the ethnicities. And it's all of these publications, they were between 2004 and 2019. And they show that the most frequent method to inject the nasolabial fluid is the linear threading, serial puncture, fanning technique, or retrograde injection. But I can add 2 other methods to the classical retrograde filler injection across the line with cannula or needle. Serial puncture that is, in the vertical position to the line by a needle. And we can add deep piriform space. I will discuss it later. And also the ligament approach. The safety point is very important because among all of these 4,000 patients, the most frequent necrosis, it was due to nasolabial fault. And this is the things that we do not consider because it is not most dangerous zone, but is most frequent zone. So by this way, you will have the higher risk of the necrosis here. So please pay attention to this point. Which filler type we can use? The HA filler, all of them, they are in these publications, the monophasic, biphasic, NASHA, Wycross, trihyol, and everything. This is the footprint of the calcium hydroxyapatite, PLLA, PDLLA, PMMA, and also collagen, porcine and bovine. But the most safe one is the HA filler. You know why? Why is most safe? Because if something happened, you have an antidote. And do not forget that the injury is beside our ears. So we should prepare ourselves against this potential problem. So, what about the trihyol technology? The trihyol technology is one of the methods to have the HA, injectable HA. It is the entanglement of the 3 types of hyaluronic acid. The very long chain, that is 3 million Dalton. Never you can find 3 million Dalton in the other products. The long chain that they are 1 million Dalton. And free HA. What is the interest to have the 3 million Dalton? Because when you use the long chain and very high molecular weight HA, you have the anti-inflammatory effect. And when you use the low molecular weight, you have the inflammatory effect. And these all, they are entangled with the free HA. And by this way, if this is a triangle, if we play on the ratio of the length of the HA, it means we can increase or decrease the ratio of the very long chain to long chain. We can play with the sculpting potential of the gel. If we play with the rate of the cross-linking, we can play with the volumizing effect of the gel. And if we play with the concentration of the free HA, we can play on the smoothing potential of the gel. So, there are, for example, a range, and by this range, you have a place in this very wonderful triangle for every single gel that exists. So, for the tissue induction, that is very important. When you inject a gel and a filler in the tissue, this is a reaction in the tissue, and we need this because the role of the filler, they are not only to fill the tissue, we need to have the positive effect also. And as you can see, after injection, one of the medium G prime products of this range, Perioral technology, we have the significant augmentation of the structural proteins like fibrillin-1, elastin, and amylin-1, significantly by 22, 16, and 41% of augmentation. There is a very wonderful publications have done by the team of the Professor Luan in China, and they compared the Perioral technology with NASHA on the back of the mice, and they show that after 1 month, 3 months, and 6 months, they have done the biopsy, and they compare with PBS also, and they measured a lot of markers. And the markers, they are the markers in inflammatory, neovascularization, regeneration, and so on. And they proved that, for example, here, the first part, it is, as you can see here, the white one is PBS, the black one is NASHA, and the Hashur one is Perioral technology. The PBS remains, stable for 6 months. The NASHA technology increased significantly till 3 months, but after that, it is stable. But the Perioral technology can increase significantly till 6 months. The same story for elastic fibers. As you can see here, the NASHA stopped after 3 months, while the Perioral technology augmented till 6 months. And here it is the CD31 for the neovascularization. It means you have the good quantity of the microcirculation. And as you can see here, the same story for Perioral technology. We have this augmentation till 6 months also. And here is TGF-beta, the marker of the tissue regeneration that we needed really for treating the skin aging. So this is a very special method. Belonging to my professor, my very dear professor, Professor Philip Hambert, maybe you know him. So this is the cutaneous microdialysis. What is this? We use a special needle. This needle we can put in the tissue, and this is the liquid can come in and come out here, and here is a semi-permeable membrane. And as we put this tissue in this needle in the tissue, we can measure every single marker that can pass through this membrane. And we can gather the water, the liquid here to do the HPLC or everything. And our first publication, it was on the measuring of the quantity of the vitamin C on the tissue. The vitamin C, as you can see here, is a very wonderful publication, show that the quantity of the vitamin C in the 60-year-old patient is half of the 20-year-old patient. And this publication, it was the first publication, before the treating the Batman purpura. Maybe you have seen these publications, and we proved that the Batman purpura is the local deficiency of the vitamin C, and we proved and we treated with this. I used the same technology to measure, the inflammatory markers between Perioral technology and Vicross. And I proved that this is a significant difference between Perioral technology and, Vicross technology. We use the highest G prime and the highest BDDE product. It is the art filler volume in this study. So even with this product, the inflammatory effect is very lower than a reference on the market. So now I would like to share with you in a couple of minutes the clinical data on the classic injection method. The classic injection method, we have done 2 big trials in Europe. And as you can see, it is, this is the data, the success rate on the nasolabial fold, that we have 83% of the success rate at 12 months and 74 at 18 months, 1.5 years after the injection. The same thing we have with the marionette line. For the marionette line, as is a moving area also, we have 100% success rate at 1 year and 82% at 1.5 years. And for the lips volume is lower because this is a medium G prime, and if, for example, the people, they need a very, very bulge lips, we should use another, more dense products. So we measured by the clinical scoring of the Lamperle, global aesthetic score, and also the basal nasolabial fold score, and by two different studies on 63 subjects and 130 subjects, we proved that the movement is the same. It means that you have a very sharp decrease just after 1 month after the injection, and this remains a plateau till the end of the study, till 18 months. And this is the miracle of the 3-Hyal technology because of the tissue induction. And we proved it exactly by the instrumental device, by Skin Station, that this drop and this same movement, and for all of these measures we are significant comparing to the baseline, that the movement is still here instrumentally and also by clinical scoring. And here it is a wonderful thing that I would like to show. This is the tissue induction. Look at here. This is the very bright, points that they are the markers of the neocollagenesis. And if you see here, this is the comparative study with Vicrous. And as you can see here, till 3 months, the skin thickness is the same. But after 3 months, we have a difference between these two technology, that it remains this difference till the end of the study. This is some data, 18 months after the injection without any touch-up, without any reinjection. The subject number 28, a male one. The subject number 37, the subject number 59. And here is for marionette line, and as you can see, the success rate for the marionette line is wonderful. 100% at 1 year and 82% after 18 months. And here is for the lip fullness. For lip fullness, I would like to show something interesting. This is the publication of Hervé Raspaldo. You may know him, he is my friend. So Hervé proved that at 3 months, the success rate of the Volbella and Restylane is around 84 and 81. And for, Universal is 82%. So they are the same range. They are the medium G prime, category. So this is the photos. Maybe this is not very bulge one because, the French people, they love the French kiss. They don't want to have the very bulge, but you can use it as you want. So now I would like to share with you, because this is my passion, Professor Wang, and I love it. I cannot go outside of the skin imaging. So this is the confocal microscopy. I would like to invite you to see this picture. Look at the cut. We are in the epidermis. And in the epidermis, you know that never we can inject a filler in the epidermis. But we have the result. What is the result? We have the irregular honeycomb pattern here. And the irregular honeycomb pattern, after 3 months, it became regular one. Why? Because we have the receptor of the CD44 that is a specific receptor for HA, and they are in common between the keratinocytes and the melanocyte and the fibroblasts. And by this way, there is an intercellular communication by hyaluronic acid. So if you do the injection in the lower part of the skin, you will have the results in all of the skin layers also. So we will go a little down. We are in the dermoepidermal junction. As you can see here we have a very limited number of the dermal papilla. And by time, as soon as 3 months, And after, as soon as 6 months, we have the augmentation of the dermal papilla number and size. And it's show that we have the, undulation of the, epidermis toward the dermis, dermoepidermal junction. And as you can see, proved by the OCT in the vertical cut. And the vertical cut, here we have the flattening of the dermoepidermal junction, as you can see here, and it's increased, and as you can see, we have the augmentation of the undulation. And when we go lower, here we are in the superficial dermis, we have the huddled collagen till 3 months, and then we have the, the thin, tiny reticulated collagen, and this is the neocollagenesis after 6 months. And this is the serial high-frequency ultrasound that you can see and you can follow by the patients. So now I will go to the deep piriform space. This is the second way to treat this area. So as you can see, the study is in press. We have done the study with my friend, Dr. Carlo Borriello from Italy, aesthetic surgeon. And as you can see, as soon as you inject in the deep piriform space, you have the augmentation of the volume in the midface. It's wonderful. And it's proved, and please wait for the publication because it's a publication, is a study on 50 subjects. So, So, the safety point is very, very important. Oh, I'm sorry. Can you help me for running the videos in this slide, please? My friend from the technical part. Can you help me to running these 2 videos, please? So, it's not working? So, doesn't matter. So, this is the anatomical part that show that at this point, although all normal variations, the artery is superficial. So, if you go deep to the bone, normally with a tilt toward the nose, it is safe injection. And as you can see here also is the ultrasound that you can see that this ultrasound is show that the artery is superficial and you can go deep to the bone. This is the bone. So the method of the injection, you should touch the bone with a little tilt toward the nose. You should stay there, fix your hand. You do the aspiration. Normally for aspiration, there is very controversy, but please do it. Some friends and some colleagues, they believe that we should do it 15 seconds, sorry. And then you inject very slowly 0.5 ml or 0.6 ml every side, and you should remove it very, very slowly. Now the clinical data on the ligament approach. It is a wonderful publication also by one of my, very nice colleagues. It is the team of the Professor Guo Li, Ji Feng, and also Tang Peng, that they compared 2 methods of injection with trial technology. And the objective was to compare the effectiveness and the safety of the ligament injection method versus the traditional one for the treatment of the moderate to severe nasolabial fold. The traditional method, the injection of the HA into the deep and superficial layer of the medial part of the nasolabial fold at a dose of 0.6. And for the ligament method, it was 2 points. 1 point, it was 0.1, the zygomatic cutaneous ligament point here. And it was the insertion between the zygomatic buccal groove and also the lateral canthus to the chelion line. And the 0.2, it was the maxillary ligament point here. Each of them, they contain 0.3 ml of the injection. The group, it was 40 subjects in 2 groups, group A and B. Group A, it was at the left side, traditional one, and right side ligament, and group B, contrary. So it was the evaluation at 4, 8, 12, and 24 weeks after the baseline, photography and Vectra, and also the possibility as a touch-up at week 4. So the assessment, it was done by the Wrinkle Severity Rating Scale, Global Aesthetic Improvement Scale, Medicis Mid-Face Volume, MMVS, Pain Visual Analog Scale, and Tactile VAS score. As you can see, there was no very big difference between two methods, unless only 2 time points at week 4 and week 8. That it was a favor of the traditional method by the wrinkle score, of the area. As you can see, this is good. This is the baseline, and as you can see, this is a difference between, the ligament part and the nasolabial part just after the injection. You can prove it by Vectra. And for the GAIS, Global Aesthetic Improvement Scale, that is a marker of the satisfaction rate, it was not a very big difference between all of the time points, unless for the week 12 for the investigators and blinded investigators, and this is for the subjects. And here, this is wonderful, because 24 weeks after, this is the side treated by the ligament method. There is the 44% of the subjects that they underwent the ligament method show the improvement after this by 16% only by the other group. So the result is longer if you use the ligament method. For the pain, it was not very significantly different, but a little better for the ligament point. And the tactile VAS score, it was more smooth in the ligament side. As a conclusion, so the Perioral technology is performant and safe treatment for the nasolabial fold in Asian adults, and the ligament method is not inferior to the traditional one, and the results remain a little longer, it is safer and easy to perform. So there are many publications around the Perioral technology. You only search on the PubMed. They are all open access. And thank you for your attention.